violence and abuse in the home, and affordable, stable, adequate housing. And I'm here to talk tonight about our mission as it relates to access to healthcare, quality healthcare services, and healthcare coverage. I'm going to start with this quote because I think this really sums up what we are talking about here tonight, and I can't say it any better. I was at a conference last week and had the opportunity to hear Dr. Atul Gawande speak. He's an author and a physician. One life is saved for every 800 enrollments in the Affordable Care Act. One life is saved for every 440 enrollments in Medicaid. And that is what we are here talking about tonight. Saving lives, people's lives. And it's my opinion that healthcare should be a basic right for all, and not just right for some. So again, we really need to talk about protecting our care and why this coverage matters. We've heard some of the speakers up here tonight talk about all of the protections under the ACA. Here are some of the really critical facts. There's a lot of rhetoric out there about the ACA being a disaster or failing. 20 million people have gained coverage under the Affordable Care Act. It is not a disaster for them. Many of you are here in the room here tonight. There are many stories to be told, and the impact is great. Here in North Carolina, during this last open enrollment period, more than 500,000 people, or 500,000 plans, in fact, were enrolled in North Carolina from that last open enrollment period. That tells us that not only here in North Carolina do people need health insurance, they're enrolling in it. More than 9 out of 10 people qualified for financial help under the ACA during this last enrollment period. And here's a little known fact that again is getting lost in the rhetoric. Yes, medical care costs are on the rise. They always have been. It's the nature of that market. Since the ACA was put into law, those costs have been rising at a lower rate than ever before. So it is making a difference. Finally, we are seeing the impact of Pisgah Legal Services in all that we do. We see the benefit of people having access to quality healthcare coverage, being able to get preventive care and treatment. We also see how many people who are medically frail can be financially frail in a healthcare crisis. Too many of our clients have to make the choice between paying for their rent and paying for their medication. Too many of our foreclosure cases, when you get to the root cause of what happened in that family situation, is because the person who was working and paying the mortgage became ill, and it was a crisis for that family. Too many children are living in homes without heat because the choice between paying for that child's medication, or paying for the parent's medication and paying for the heat, or paying for food, is a choice that has to be made. And these are such hard choices. As poverty law attorneys, we see the benefit of having access and quality healthcare coverage. It's a tool to respond to poverty. It's something that we would love to see for everyone. John talked a lot about this, so I just want to point out a couple of really key pieces of, and here's the full name of the ACA, by the way, the Patient Protection and Affordable Care Act. Let us not forget about all of the patient protections that were put in place, not just for those of us who are enrolled under ACA coverage plans, but for all of us who are reached by many of these protections under the coverage that we have, many of us through employer-sponsored coverage and large group coverage. Again, no denials for pre-existing conditions, many free preventive services, including contraceptive care, no lifetime caps on care, and again, for a very young child born sick, they can reach that cap in a week, in a month. No discrimination based on gender. Women prior to the ACA becoming law were charged up to 47% more than men for health insurance here in North Carolina. Mental health and substance use parity, something that we haven't mentioned much tonight. Under the Essential Health Benefits Package, mental health care and substance use treatment is covered, just like any other essential health benefit. That is very important to many of our people here in the community. It means that you have access to whole body care, whole person care, whatever your needs may be. And if that goes away, there are many people who will suffer because of that. The medical loss ratio, again, The idea, as John mentioned, and this was Senator Al Franken that wrote this piece of the law, that the payments that we are making for premiums are put towards our care. Between 80 and 85% must go to our care. And if not, it needs to be reimbursed to us according to the law. The uninsured rate in our country is at an all-time historic low. That's what that graph shows you. I know it's probably hard for some of you to see it far away. I'm sorry about that. But I wanted to show that dramatic dip because, again, we keep hearing that it's not working, but people have got coverage, and the uninsured rate has dropped significantly. It's even lower. It says 10.0 right there. It's actually closer to about 9% at this point. But that chart is important, and the reason I added it in here is because on the other side, people were asked about, did they understand where the uninsured rate was right now? And only 26% knew that we were at an all-time low. The majority of people asked thought it was about the same as it had been. So again, it's really important that we talk about this and that we bring out the facts because it's working, people are covered, and it means something. This coverage matters. In protecting our care, of course, the ACA right now is at the forefront of all the news coverage. Every day we're hearing about new ideas, new plans, new changes. What we also need to pay attention to is that Medicaid and Medicare are also at risk. Now, Medicaid is a program that nationwide serves more than 70 million people, many low-income, vulnerable people, including children. In North Carolina, we have something called categorical eligibility, meaning that you must be poor and fit into a category of a poor person in order to qualify for Medicaid. That is currently how the law stands today. And here are the examples. You need to be disabled, and that is according to the Social Security Administration's definition. Or you have to be a child who's low income, or an older adult who is low income, or a pregnant woman who is low income. These are some of those categories. And as the doctor was talking about, Medicaid expansion was looking to close that coverage gap. Closing the coverage gap, meaning that take the category away and provide Medicaid to all adults and children who fall within a certain income level. So that people, and it's estimated between 300,000 and 500,000 people here in North Carolina, are in that coverage gap. So again, as we talk about health insurance and making sure people are covered, we must close that gap. Governor Cooper attempted to close that gap. It's currently pending in federal court right now. But here's a visual of what I'm talking about. Here's who's left out. This is an umbrella. The red far side over there shows those persons who fall into those specific groups who are